Today, we will discuss some basics about the kidneys, an organ of the urinary system. Three main topics on the kidneys will be presented: the basic anatomy, physiology, and a few common pathologies. In our presentation of kidney anatomy, we will discuss the musculature, the great vessels, kidney segmentation, as well as some related viscera. The right kidney is located slightly lower than the left kidney. Each has an adrenal gland located on their superior lobes. A ureter is attached to each kidney at the hilum to drain the urine from the kidney to the bladder for storage until excretion occurs. The kidneys are located within the abdominal cavity. When we peel back other major viscera, we find a pair of kidneys nestled adjacent to the posterior abdominal wall created by the diaphragm. The four main muscles related to the kidney are the diaphragm, the psoas major, the quadratus lumborum, and the transversus abdominis, which is part of the abdominal wall. Also notice, in the transverse view of the kidney, you can see the kidney is surrounded by a unique arrangement of fat and fascia. Perinephritic fat completely encloses the kidneys, then a membranous layer of renal fascia further protects the kidneys. Paranephritic fat and the transversalis fascia complete the unique layering of fat and fascia protecting the kidneys. Lastly, the peritoneum also provides protection to the retroperitoneal kidneys. As we move on to the great vessels, notice the relation of the kidneys to both the aorta and the inferior vena cava. Both pass between the kidneys as they travel from the thoracic cavity and branch into the pelvic cavity. The arterial supply to the kidney and the ureter depicted in the image on the right shows the aorta directly supplies the kidney with a renal artery via the hilum. The aorta also gives multiple arterial branches to supply the ureter as it descends from the kidney to the bladder. In relation between the kidneys and the great vessels, we see the right renal artery is longer and often inferior to the left renal artery. It passes posterior to the inferior vena cava and the right renal vein. The left renal artery passes between the left renal vein and the splenic vein. As you can see, generally each kidney is supplied by a single renal artery in approximately 70% of the populace. Although, a fun fact, some people have branches of the renal artery in various patterns, as shown at the bottom of the slide. Lastly, near the renal hilum, each artery divides into an anterior and posterior division, which divides again into segmental arteries supplying the renal vasculature segments. The kidney segments were originally discovered in 1794 by John Hunter. The first detailed account of the kidney's arterial segments were created in the 1950s thanks to radiographic technology and resin casts, which further identified the 5 segments of the kidney shown here: the apical, superior, middle, inferior, and posterior segments. In the resin cast provided by the museums of Royal College of Surgeons, the ureters appear in yellow, but it is the vasculature of the kidneys in red that is truly quite impressive. The stomach, duodenum, jejunum, and pancreas are all anterior to the kidneys. The smaller image on the right shows how the kidneys rest adjacent to the posterior abdominal wall within the abdominal thoracic cavity in relation to the muscles, viscera, and great vessels. The liver has perhaps the most anatomically significant relation to the right kidney. The liver makes the right kidney sit lower in the abdominal thoracic cavity. The transverse image of the abdomen depicts the right kidney nestled medially to the liver. Similarly, the left kidney is medial to the spleen. In the next section, we will discuss the physiology of the kidneys. Kidneys have exocrine, endocrine, and regulatory functions. They are responsible to excrete urine, secrete and synthesize hormones, and regulate blood pressure and the volume of bodily fluids. As we peek inside this bean-shaped capsule, we find several small pyramid-shaped medullas surrounded by the cortex. The innermost tip of the medulla is called the renal papilla, which empties into the ureter via the minor and major calyxes. The ureter transports the urine to the bladder for excretion from the body, an exocrine function of the kidney. Looking closely inside the kidney, we find a highly detailed structure called a nephron, coursing between the cortex and the medulla. There are over 1 million nephrons in a kidney, each filtering the blood, which leads to the formation of urine. Nephrons produce urine through a filtration process. Thus, wastes are removed from the blood before toxicity occurs. Filtration begins in Bowman's space, and in the proximal convoluted tubule, important elements are reabsorbed, and uric acid and other organic acids are secreted to become urine. As the fluid travels to the loop of Henle, water and salt are absorbed. In the distal convoluted tubule, reabsorption of additional water and salt, plus the secretion of potassium and hydrogen ions, occur before dumping the remaining contents into the collecting duct. From the collecting duct, the byproducts are excreted towards the ureter and becomes urine. Another physiologic process of the kidneys relates to the endocrine system, with the production and secretion of hormones. The RAAS, or renin-angiotensin-aldosterone system depicted here, is perhaps the most important endocrine process of the kidneys. The hormones secreted by the endocrine actions of the kidneys influence the regulatory functions of the kidneys by acting on the blood pressure. This occurs by transforming angiotensinogen from the liver into angiotensinogen 2. The hormones renin and ACE make this transformation possible. Angiotensinogen 2 allows the body to perform 5 other functions, which includes the production of 2 major hormones that control the rate of water excretion in nephron function, aldosterone and ADH. Aldosterone increases the rate of water reabsorption as it acts on the distal convoluted tubule. ADH, the antidiuretic hormone, is released from the pituitary gland in the brain to help the kidneys reabsorb more water in the collecting ducts. Both hormones are released when the body needs to retain water, such as in dehydration. Thus, the kidneys function to increase blood pressure as they regulate bodily fluids. Lastly, the main player in regulating blood pressure is the hormone renin, which is secreted by 3 triggers: low blood pressure, the distal tubule sensing low salt, which is interpreted as low blood pressure, or an increased stimulation in the sympathetic nerves when you become frightened or stressed. The anatomy and physiology of the kidneys gives us the ability to hold a deeper understanding of kidney pathologies. We will explore 3: kidney infections, kidney stones, and kidney failure. A type of bacterial UTI, or urinary tract infection, that often begins in the urethra, bladder, or ureters and travels to the kidneys is called a kidney infection, which can be cleared with antibiotics, although it requires prompt medical attention to prevent permanent damage to a kidney or the spread of bacteria into the circulatory system. To prevent kidney infections, urinate when you need to and after intercourse, wipe carefully, and drink lots of fluids. Kidney stones are formed by a combination of salts and minerals within your urine crystallizing together. This occurs because the ratio of crystal-forming substances is higher than your urine can dilute, to prevent crystals from sticking together. This causes pain. Blood in the urine and frequent urination are also signs of kidney stones. There are no definite cause to the formation of kidney stones, but dehydration, a history of kidney infections, obesity, as well as diets high in salt and fat, and sugar are all strongly correlated to kidney stones. Although painful, sometimes kidney stones can be passed through the urine by drinking lots of water. A gradual loss of kidney function that worsens over several months or years is diagnosed as kidney failure. In advanced stages, the kidney no longer filters wastes or excess fluids from the body. The signs and symptoms are few and generalized, such as vomiting, high blood pressure, and fatigue. Diseases that lead to kidney failure include high blood pressure, kidney stones, and recurring kidney infections. When an underlying condition leads to dangerous levels of fluid, electrolytes, and wastes building up in the body, the kidneys fail. Kidney failure is fatal. Extensive research is being performed to predict kidney failure earlier. According to a 2019 study from the Denver School of Medicine, no improvements have occurred yet.